I want to welcome you to our program with Stamford Health, Pickleball Injuries and How to Prevent Them. Pickleball, the fastest growing sport in America, is quickly attracting enthusiasts from all backgrounds to the courts for some exercise and fun. Unfortunately, all this fun has led to a rise in pickleball-related injuries, which our esteemed panel will discuss this evening. Before we begin, I'd like to mention that programs at Darien Library are made possible by the annual Friends of the Library campaign. We thank you for your support to make programs like this possible and our collections available to the community. And now, on to our presenters. Dr. Jaclyn McKenna is an assistant attending physician at Hospital for Special Surgery, specializing in the non-surgical treatment of various acute, overuse, and chronic musculoskeletal injuries. She is board certified in internal medicine with an additional certificate in sports medicine. She is a former Division I college basketball and volleyball player and served as a team physician for University of South Carolina, providing sideline coverage for the football, women's basketball, and baseball teams during her fellowship. Dr. Carl Cirino is an accomplished orthopedic surgeon specializing in shoulder and elbow care at the HSS Sports Medicine Institute. He also holds the position of assistant professor of orthopedic surgery at York-Presbyterian Hospital and Weill Cornell Medical College. Dr. Cirino's expertise spans the spectrum of the shoulder and elbow conditions. He served as a shoulder and elbow surgical fellow at HSS, where he provided medical coverage for the New York Mets. Stephen Ciliotta is a licensed physical therapist with over 10 years of experience in the outpatient setting. He enjoys helping patients with musculoskeletal injuries and conditions to eliminate pain and return to activities that they love. Stephen is board certified in all orthopedics through the American Physical Therapy Association and has taken extensive coursework in movement, assessment, and manual therapy. Before we begin, you will have had a handout at the end of the program. If you don't mind filling out the survey of this program, that would be wonderful. Thank you and welcome.
Hi, everyone. So I'm Jaclyn McKenna. You kind of got the intro on me, but just to run through what we're going to do tonight, we're each going to chat for about 15 minutes each, and we'll take questions at the end. Like was said, I have an internal medicine background, so general primary care, adult medicine, and then I did sports medicine training after that. So I'm going to talk more about general prevention, some overlapping medical considerations to think about. And then Dr. Cirino is going to kind of do more of a head-to-toe, run through some of the most common injuries, and then Dr. Ciliotta is going to go through some exercises and warm up at the end. All right, so a little bit about me. I was a volleyball, basketball player growing up, but we did play pickleball when I was in high school. It was like the favorite unit in our gym class. I don't think we had all the right rules. I don't remember there being a kitchen, but I have been playing a little bit over the last couple summers with family. My mom plays a lot, and then my cousin's a full-time pickleball coach, so she gave me some tidbits for this one. But I mostly play beach volleyball now, so I feel like there's some similarities. It's outdoor, doubles, volley sport, so excuse me if I make some correlations to that. So I'm going to give you you don't need really an intro to pickleball, but an intro to some of the data that we do have regarding who's participating and what injuries we're seeing, and then I have 9 tips for general prevention. So pickleball could be played singles or doubles. Volleyball, the volley sport with paddles and a ball on a hard court, growing in popularity in recent years, which is a total understatement. But especially a few years ago, starting out, a lot of people considered pickleball to just be more of a milder version of tennis, less running, less impact, and really more social, which is great, but it's definitely evolved into having some very high-level athletes playing for a lot of hours, and injuries can be very common. So some awesome things about pickleball: really any age group can play. It's low impact. The rules are really simple. It's easy for beginners to pick up a paddle and just play day one and have fun. There are places to play everywhere. I hear there's like a ginormous place in Stamford that's being built. It could be played indoor and outdoor. It's one of the unique sports that can really fuel people's competitive drive. That's not like a one versus one or solo sport. So I think that's a big reason why it's so popular too. And then of course, it's social, which is great. So people who are playing pickleball now, so this paper that I was looking at data over the last 10 years, so even the last 2-3 years might look a little bit different, but the participants tend to be 50s, 60s, 70-year-olds. I think the younger populations are probably increasing as well, but 75% are over age 55, and especially a lot of women are playing too. And then when we look at the proportion of injuries that are occurring, that 60s, 70s age group especially, even in proportion to the amount of people who are playing, are really having a high prevalence of injuries. So 85% of all pickleball injuries are occurring in players 60 years or older. So again, this is looking at overall data over the last 10 years or so. Actually, I think this one is more like the last 20 years. So I'd imagine that if we looked at more, if there was more current data out, it would, age groups 40s, 50s, you might see a rise in that as well. Okay, so why are we at increased risk for injuries as we age? Our bones get weaker and less dense. That's a process that occurs, and there's some things we can do to prevent the decline, but inevitably you're going to have some weakening of bones with each decade. In general, less conditioning, diminished motor skills, and impaired balance and proprioception, which is being able to have that brain to hand-foot coordination of where your body is in space. And then more pickleball specifically. A lot of times people are playing pickleball as a way to start getting active again, which is great, but if you haven't played sports in a while that require more of that hand-eye coordination or lateral movement, you're just using your nervous system and muscles in a different way, and anything that's new puts you at risk for injury. And then plus, people are playing many, many hours a week now, so there's increased risk of chronic injuries as well. When we look at data for which types of injuries we have, so there's a mix of acute and chronic injuries. Both are very common, but when we look at acute injuries, by far and away the most common cause of an acute injury is a trip and fall mechanism. So these can result in sprains, strains, fractures, contusions, abrasions, lacerations. Those are really the top ones on that chart there. The frequency of leg injuries versus arm injuries is pretty similar, and the rates are similar for injuries amongst men and women. But it's important to note that because women have weaker bone densities, especially after menopause, are at increased risk of fracture. So about 4 times more likely to have a fracture compared to men, and specifically 9 times more likely to have a wrist fracture, which is very commonly seen in pickleball. All right, so how can we prevent injuries? So I'm going to go through 9 ways we can prevent injuries. One is to prepare before you go out. So it's a good idea to have a pickleball bag kind of separate, ready with any supplies you may need. You guys will all have your balls and paddles, that's not an issue. But some other considerations is bringing a towel. The importance of having a dry court to play on cannot be overstated. Probably one for your skin and then like a rag to just dry up the court is a good idea to just have on hand. If you're playing outside, sun protection, hat, sunglasses, sunscreen. Proper shoes I'll talk about a little bit. Plenty of water and snacks if you're going out for a few hours. And then just think about like any medical supplies you might need. Band-Aids, you like never have them when you need them, but easy to throw in the bag just in case. And then contact lenses or any specific medical equipment that you might need. Just have that ready. All right, so court shoes. There's a big difference between court shoes and running shoes. So running shoes have a rocker bottom and are really designed for you to go in a sagittal straight plane of motion. So because of the way they're shaped, if you try to move laterally in them, you have increased risk of tripping. So there's some specific pickleball shoes out there. You don't necessarily need to have a pickleball shoe, but a tennis shoe, a basketball shoe, volleyball shoe, if they're advertised as those sports that are played on a court that require you to shuffle laterally, those are all good options. Different shoes will have different levels of ankle support too, depending on your needs. And then just remember to, if you feel like your shoes are getting worn, a little bit too late. So keep tabs on the treads. All right, protective eyewear. So I realize that not everyone really wears protective eyewear, but it is the recommendation for any kind of small projectile type sport, especially when you're volleying in the kitchen. It's just very fast movements, very close together. So I would say, especially if you have like vision problems to begin with, one, you might be less likely to see the ball and react quickly, but an injury might be even more costly. If you're someone who even has like one good eye and one bad eye, you don't want to hurt your good eye. So a good idea to wear eye protection. You can get glasses or goggles. The most important thing is you want polycarbonate impact resistance sport goggles. And then if you wear sunglasses, make sure they fit those specs as well. All right, number 2 is to consider the weather before you go out. Hopefully I don't have to say that in rain or snow, it's probably best to just bring it inside, dress in layers. But I did want to make, I did put a couple slides about playing in the heat. Not this time of year, but especially like if you guys go down to Florida in April, May, and are just not acclimated, you have increased risk of heat illness. So there's heat illness and heat stroke are on a spectrum. There's a lot of different symptoms that someone can have when they're having a heat stroke. Neurologic symptoms, muscle cramps, but even in more severe cases, someone can just present with delirium or a change in behavior. So it can be a little more, I don't want to say subtle, but it might not, you might see these things and not immediately think this person's having a heat stroke. But this is completely a medical emergency. It needs to be treated within 30 minutes. So I'm going to talk about how to prevent this, but especially when I was in South Carolina with the football team, we saw a lot of heat illness down there, and especially in that first week of preseason, the first 3 weeks, it really takes to acclimate to the heat. So really just have a lot of caution going into those first couple weeks in the hot weather. There's some risk factors that put people at risk for heat illness. So, of course, hot weather, individual factors, being older, your body is not able to cool itself as efficiently, not being well hydrated, and then just run through medications that you're on, diuretics, a lot of heart medicines like metoprolol, carvedilol, those decrease your heart rate, so you might not be able to increase your heart rate as well to sort of compensate in the heat, stimulant medications, and then if you have cardiovascular disease or you have a viral illness going on, those are all increasing your risk. So ways to prevent illness in the heat, you want to stay hydrated, so pretty much all the time, 24 hours even before you get out there. Cold water is best to keep you cool during play, and then don't forget about electrolyte replacements as well. You don't necessarily need to buy the fancy ones, but keeping snacks on board, even just like pretzels or things if you're out there for hours and you're only drinking water, it can put you at risk for hyponatremia and even cramping. Dressing appropriately, so layers is best. Sometimes once your body gets moving, you realize you don't need the sweater. And really the most important thing those first few days in the heat is to just take more breaks. I know when I play beach volleyball and it's a really hot day, sometimes we'll just say, hey guys, we're going to just take a mandatory timeout at the 11-point mark because the games are 21, and then just mutually, everyone's going to take a break then. So that's a good option for pickleball because sometimes the games can go really long with the side-outs. Well, I'm going to call it side-out scoring, but you only score when you serve. And then if you're playing with a larger group, you can rotate and take breaks, and then just decreasing the total duration of play too. So these are the exact recommendations that we would give to a college football team. The first step is to just take more breaks on a hot day. And again, it typically takes about 3 weeks to adjust. And in the college setting too, day 4 or 5 were the most brutal ones. So it is a cumulative heat exposure that puts you at risk. All right, number 3 is to inspect your surroundings. So we talked a little bit about a wet court, but you see on TV all the time, right? Like basketball, people will be like, ref, and then someone will come over and wipe it. So you should be that diligent with making sure the court is dry. you shouldn't be able to skid if you're testing it like that. Okay. Check out the court for any large cracks. Avoid them if you can. And then just any other hazards, bags, spectators, things like that. It's good to just set some ground rules before you start playing. Maybe this side is automatically out of bounds, something like that. Number 4, be prepared for a medical emergency. This doesn't have to be a super dramatic thing, but just the thought process of thinking through a few situations that could come up if you're playing, whether it's outdoor or indoor, just knowing where the AED is in case you need it. Consider exchanging emergency phone numbers with people you're playing with, and then if you have any specific medical conditions, on insulin, have a pacemaker, have a seizure disorder, things like that, just maybe give people around you a heads up so they can respond faster should something happen. All right, number 5, this is the one my cousin was most adamant about, is a good warm-up. So she was saying that everyone just goes, okay, let's just want to dink around, and that really is getting like your nervous system, like your hand-eye coordination going a little bit, but it's really not a full comprehensive warm-up. So we're going to do this at the end in a little more detail, but the components of a warm-up is you want to actually warm the muscle tissues up first, incorporate dynamic stretching, so getting the full range of motion in your upper and lower body joints. And then you want to do something to sort of prime the nervous system as well, so like some side shuffles or sprints and stops. Your warm-up should be very game-like. Then you can incorporate like dinking or skinny singles or warm-up drill. And then just keep in mind, older adults might take some time, well, a longer time to warm up. All right, 6 is how to avoid some injuries during play. So like I said, the biggest thing we want to do is prevent a fall or a twisting type mechanism of injury. So first things first is to just stay in a ready position and be prepared. It's more of a position, so an athletic position, knees, hips bent, weight evenly distributed, being ready to move in each direction. But I think mentally too, it's being ready to anticipate a short ball, anticipating a deep ball instead of getting caught standing and then reacting to the ball. I think it could make a world of difference. And then another thing is to be careful when you're moving forward. Sudden stopping and starting can increase risk of ankle and knee injuries. And then was another big one, to avoid backpedaling. So my mom fell this way. So it's always easier to move forward than it is to move back. We're faster that way. And it's a lot safer for preventing falls. So if you do, if someone is hitting a lob shot over you, and this was a volleyball thing too, the best way to do it is to turn and burn. So open up, pivot, keep your eye on the ball, and then try to run forward as best you can to get to the ball, then turn, instead of backpedaling, because you could trip on something behind you, and it's a good way to hurt your head. So just really, really let those ones go if you're not being able to do this the right way. Learning how to fall. This is really hard to learn how to fall because I wouldn't recommend practicing it necessarily. But just being careful to not try to stop. If you're falling, you're falling, and trying to stop your whole fall with one hand is just putting all that weight in one spot. So it's better to kind of use your tush or sides and let it absorb that there better. And then avoiding collisions with other people while you're playing, so calling the ball. If another ball rolls onto the court, you should just stop the point. Same thing if your ball rolls onto the court next to you. Don't just say like, okay, I'm just going to grab it off their court. Just say, hey guys, ball's on the court, and then they're going to stop their point too. Okay, number 7, just know your limits. It's okay to let some balls go that are outside your range. This is also a volleyball thing where you're kind of prepared for the first 2 shots, but the third one, the hard cut shot across, like if you're not going to get there anyway, it's okay. You don't have to go all out for it. But everyone's limits are different. And then more on the long term is just monitor your playing load. Initially in the moment, it might seem like it's not that taxing, but the hours a week can add up pretty quickly. And it's better to just, if you are increasing your play, just increase it gradually, make sure your body's tolerating it well before you just go out and play like 6 days in a row because you're on vacation or something. Number 8 is that pickleball is awesome, but it shouldn't be the only thing you do. So these are some of the well-established recommendations. Pickleball is moderate intensity exercise, so 150 to 300 minutes a week, you hit that marker, but incorporating some strength training at least twice a week and some flexibility training at least a couple times a week too are very important. And then just a quick note, number 9 was if you may need to see your primary care doctor if you do have a history of cardiovascular disease, osteoporosis, kidney disease, metabolic disease. It's just a good idea to check in. Do you need a stress test? Are you having any of these symptoms? Chest pain, neck pain, jaw pain, shortness of breath with mild exertion or with sleeping, new ankle swelling, palpitations, or leg burning or pain with exertion. All reasons to just get tuned up before you start something new. Okay, so just to recap, these were my 9. Bring the correct gear and supplies, especially the shoes. Consider the weather conditions and exercise caution in the heat. Consider the court conditions, dry, avoid the cracks. Have an emergency plan. Thinking is not a warm-up. And then avoiding falls, turn and burn instead of backpedaling. Know your personal limits. Pickleball should not be your only form of exercise, and then consider checking in with your primary care. Okay. Thanks.
So my name's Carl Cirino. I'll talk to you guys a little bit more about pickleball injuries. Has anyone had a pickleball injury? Or is that why you're here tonight? Okay. All right, so number of hands. Dr. McKenna gave some great tips to avoid injury and how to warm up properly. Can't hear me? Okay. Is that better? All right, I'll try to speak a little louder. So Dr. McKenna gave some great tips for avoiding injury, but if you do unfortunately get into a position where you are injured, there's ways that we can help. So please let us know. So about me. All right, so who am I? I'm a shoulder and elbow surgeon at the Hospital for Special Surgery. I was born and raised just, up the road in Westport. But don't worry, Darien always beat us in lacrosse, so I don't harbor any ill will. And I'm a son of an avid pickleballer. Here's my mom with some of her friends getting a lesson down at Campo Beach. So, I think this is a really big takeaway. It doesn't so much relate to what I'm going to talk about, but to what the other 2 talks are. An ounce of prevention is worth a pound of cure. Does anyone know who said that? So it was Benjamin Franklin. He's a really smart guy. He probably wasn't talking about pickleball back then in the 1700s, but it's applicable to everything we do in life, whether it's pickleball, financial planning, getting ready for surgery, whatever it may be. So you guys may have seen this headline as well. Pickleball injuries may cost Americans nearly $400 million this year. And probably not intentionally, but that's a lot of Benjamins, right? So it's something that, is a personal cost to you. You may have time out of work. It costs the health system, dollars. It costs the work system to have to replace you if you're unable to work and all those things. So I think coming to these talks is great to, try to learn what you can. This is from a website called PubMed. This is where all of our medical literature lives. And as you can see, the number of articles talking about pickleball are just rising year over year. 2023 is not fully in yet, but I can almost guarantee that'll exceed the number of articles from the prior year. Just like the number of players goes up, the number of injuries goes up, the number of money spent on the sport is going up. So Dr. McKenna touched upon this a little bit. The primary mechanism for people getting injured in pickleball is a slip, a trip, a fall, a dive, either due to the court surfaces, just overextending yourself, More rarely, you might be hit by the ball, heat-related illness. We had a great review of getting hit with the racket, hitting another player, things like that. But, by far, the number one is that slip, trip, fall, and dive. So whatever you can do to prevent that, that's going to be key. And then when thinking about injuries, I think you need to think about a spectrum. So there's acute injuries. Those are traumatic injuries. Those are, my shoulder was fine 5 minutes ago, I just fell, and now my shoulder doesn't work. Versus chronic, where maybe you've had some shoulder pain for a long time, you start playing pickleball, the shoulder starts hurting a little bit more. That might fall into a tendinosis or an arthritis type of picture, versus if you fall on your shoulder and you have a dislocation, a fracture, a tear, something like that. Breaking down the pickleball injuries into body parts, upper extremity leads the way at about a third of them. Lower extremity just behind at 30%. Head, neck, trunk, and all of the body come in after that. So I'm a shoulder and elbow surgeon, so we'll start with the upper extremity. By far the most common injury here is wrist, and we'll kind of go through some of these and what the most common ones are. So in shoulder, which is about 5% of injuries, you can injure the rotator cuff, the glenohumeral or shoulder joint, the acromioclavicular joint, the clavicle or collarbone, or your biceps tendon. Rotator cuff, if we took MRIs of all the patients in the room right now, even if you have no shoulder pain, probably about a third of people are going to have a rotator cuff tear. It may not be clinically significant, but so we put a lot of work into our shoulders over the years, and then the rotator cuff can thin and wear down over time. Usually when it becomes a full thickness tear is when you can start to have symptoms, but you can have a lot of symptoms in tendinitis even without a tear. So in the way that this kind of happens is, we're constantly rubbing the shoulder, rotating it. It can wear out over time, get thinner, kind of like the treads on your tire. But at some point you may have a blowout of that tire and then need the tire to be replaced or the shoulder to be fixed. So here's the glenohumeral joint. This is the shoulder joint. This is a normal shoulder x-ray without arthritis. But as time goes on, the cartilage in the shoulder can wear away. Same in your hip. If you've had a hip replacement, knee replacement, you go from a nice shock absorber with cartilage to bone on bone. And you can imagine that no matter what you do, the shoulder's going to hurt if you're playing pickleball, if you're driving, if you're putting things up in the closet. The labrum is a kind of like a bumper for the shoulder as well. The analogy that we use is that the shoulder is like a golf ball on a tee, and you can imagine that the glenoid would be, the labrum would be a little bumper to prevent the golf ball from falling off the tee. So the shoulder, if you dislocate your shoulder, you can tear that and have a problem with that, which needs to be fixed. Finally, you can have a fracture. So you can fracture the glenoid, which is the T or the socket. You can fracture the ball. You can fracture the shoulder. And those are, obviously more traumatic injuries that require a higher level of intervention. You guys may have heard of the acromioclavicular joint or the AC joint, which is here on the top of your shoulder. This can be sprained or strained, or you can actually tear the ligaments and have a separation of that. That's what we call a shoulder separation. If you're a football fan, Carr on the Saints had this injury on Sunday. So, something that if you fall directly on the shoulder, you can have. You can also have fractures there as well. Clavicle, same idea. It's a bone. I'll go through lots of bones in this talk. Any of them can break if you fall on them. Another more common injury or condition you might see is biceps tendinitis. The biceps is, one of the muscles in the arm, obviously, and the tendon runs right through the shoulder joint. So when we raise our arm up like this, it gets pinched in the shoulder joint. If you do that enough times, it can create irritation, inflammation, tearing, the same way the rotator cuff tendon could tear. Moving on to the humerus, this is the long bone of the arm, the main bone of the arm. There's not much that can really happen here besides a fracture, and that's going to result from a trip and fall or something like that directly onto the arm. The elbow. So, the main structures around the elbow will be the biceps tendon, the triceps tendon, the common flexor and extensor tendons. You have the elbow joint itself, and then there's nerves that obviously help our arm function. The most common problem with the biceps tendon at the elbow is that it could rupture, and you may have had friends or family members or yourself had this injury, but you kind of turn into Popeye where the muscle balls all the way up and needs to be fixed. Same thing can happen to the triceps tendon in the back. It's a lot less common, but what you may see as well is something called the olecranon fracture, which the olecranon is this hard bone right in the back of your elbow. You know, we sometimes call that the funny bone. And if you fall, that bone can break. And pretty much what happens there is the tricep is stronger than the bone, and the bone will pull away. Here's one that is also very common with pickleball. We call it golfer's elbow. This is going to be inflammation or pain on the inside of the elbow. And you can imagine as all the times you're flexing your wrist to make a shot, to hit the ball, you can have strain on that structure. It's called golfer's elbow. Obviously, a lot of other people besides golfers get it. But if you have pain on the inside of your elbow, that's what this may be. The opposite side of the arm is tennis elbow. So another common problem is you extend your wrist, the muscles in the forearm continue to fire, and you can get wear and tear of that. So tennis elbow is one of the most common elbow complaints, one of the most common elbow conditions, something that almost everybody goes through at some point in their life as, we just continue as we age. The elbow joint can also become arthritic. You can have a fracture or dislocation. As I said, that'll be a theme over and over with all of the kind of injuries that you can have. And then nerves. So you guys may have heard of carpal tunnel syndrome. You may have your fingers get numb at night when you sleep. What can happen is as you exercise, your muscles will swell and compress some of these nerves, and you may get, intermittent or transient numbing of your fingers. It's just something to look out for. It's not necessarily a medical emergency, but kind of like carpal tunnel syndrome, it can affect the function of your hand. The wrist, Dr. McKenna alluded to this, but the wrist fracture is the most common fracture in adults, and they account for 17.5% of all the fractures that we see in adults. So it's very common. That's why it's very important, not only to, try to maintain your health, but take vitamin D, take calcium, try to maintain your bone density. Then at the wrist, there's just a couple more things. There's tendonitis of the wrist. One's called dequer veins. This is going to be on the front of your wrist. It's, again, something that you get from constantly hitting shots. Same thing can happen on the other side of the wrist. So the extensor carpi ulnaris is on the inside of the wrist by the pinky and can cause pain in a similar way. So that's it for upper extremity. I know that's kind of a whirlwind. Any questions about that? Good.
What are some of the exercises that you do, let's say, if your wrist and your elbow are like two chronic sensitive areas, can you stretch or counter stretch?
Yeah, definitely.
And how do you do that?
Yeah, I think we'll probably go into a little bit more of the warm-up exercises later. But just maintaining loose and mobile joints is going to be the best way to do it. So forearm stretches like this will help stretch out the forearm going the other way. And then to Dr. McKenna's point earlier, just warming up those muscles in a general, getting your blood heart rate up and the blood pumping through those muscles will help loosen those up naturally as well. But we'll go into a little bit more detail about that after. Sure. Yeah. So bursitis, it can happen in the shoulder, around the rotator cuff, very commonly. It's definitely a condition. It's probably more on the chronic side of things, where it's a repetitive sort of thing. It's something that we can manage usually without surgery, and anti-inflammatories or maybe a cortisone injection to help reduce pain and get you back. But it's obviously very common in the shoulder.
I've had a terrible flare-up, tennis elbow.
Yep.
Is it best to just rest it? Again, this might be coming up, but if this is like a common nuisance of your life, for sports and all the rest, mean, is there a surgical solution for that?
Yeah, so if I had to estimate, I'd say probably less than 5% of cases of tennis elbow go on to needing surgery, because usually if you just wait long enough, it goes away on its own. Some people don't have the patience to wait anymore because it's, inhibiting their ability to play tennis and be active, and for your mental health, it's obviously very important to do those things. So, or if it's your professional career to do something, then you can't wait, a year, 2 years for it to get better. That's, another good reason. But usually you can manage that non-operatively with physical therapy, anti-inflammatories, things like that.
Will you be covering hamstrings in one of those categories?
Yeah, so we'll go into that now. It's a good transition. So, lower extremity injuries, hip, thigh, knee, lower leg, ankle, foot, all the body parts as you go down. It's kind of like the children's song. Probably the most common injury in the lower extremities could be, a muscle strain, muscle sprain, things like that. And that relates to your question about the hamstrings and really highlights the importance of warming up, because, cold muscles have less elasticity, less ability to take an insult, take, a stress to them. So the warm-ups can be key for those. And hamstring injuries are very common. They kind of fall into the rotator cuff set of things in my mind, where you can have a lot of wear and tear to those over time, where you get tendinosis or general wearing down or thinning of the tendon. But over time, it can actually rupture and tear and have a more significant injury. For tendon ruptures, the Achilles is probably one of the most traumatic injuries in the lower extremity for pickleball. If you're a Jets fan, I'm sorry that Aaron Rodgers suffered from this injury this year and kind of set the year back a little bit. But these are things that are, you're not going to get back up and play from. Your quadriceps tendon is on the top of your knee, above your kneecap. Your patella tendon's below it. These are pretty significant injuries that usually require surgical intervention. That's a picture of the patella, the quadriceps tendon on top, and the patellar tendon on the bottom. Moving down the knee a little bit, moving down the leg to the knee, meniscus tears are very common. You can have, again, if we took everyone's knee MRIs today, we'd probably see some wear and tear, some, gradual meniscus tearing, but you can have a more traumatic tear to that structure that, can cause pain and significant disability. I kind of grouped all these together. Ligament sprains are, the first stage of an injury to a ligament. Tears are kind of the more severe injury to those ligaments. And, the ankle has lots of ligaments. If you sprain your ankle, you become more likely to sprain your ankle again in the future. So it's important to take those seriously and treat them. The ACL, the MCL, and the knee, those are kind of very sports-oriented injuries that you can have. And then turf toe is an injury to the plantar surface of the foot, of the big toe, which highlights the importance of what Dr. McKenna was talking about with wearing proper shoes that have proper support so that you don't find yourself exposed to an injury there. Arthritis, again, this is, common, and it's not necessarily a pickleball injury, but can be flared up by pickleball. So hip, knee, foot arthritis, these are all things that are going to be kind of exacerbated by playing for long periods of time on a hard court. And really is why it's important to kind of manage the time that you're playing, not playing every day for 4 or 5 hours, and giving yourself adequate time to recover. And I think finally fractures, these can happen anywhere. I mentioned the wrist is the most common fracture. Overall, hip fractures are the second most common overall fracture in adults, but you can have them in the knee. My roommate from medical school fixed a pickleball-related knee fracture today. This is a picture of an ankle fracture that would need surgery to be fixed, and then the foot as well. So, any questions now? Otherwise, we can move to Stephen's warm-up session and then take more questions at the end. Yeah, so turf toe happens when your big toe extends very quickly and kind of unexpectedly. So there's a ligament on the bottom of the toe that can tear and becomes very, very, very painful. It seems like it's not a big deal, but it keeps basketball players out for entire seasons sometimes, because once you tear it, we walk every day. It's not easy to protect that toe. So every step, it just kind of gets re-irritated. Yeah.
A little bit about me. I grew up in Long Island. I've been a PT for about 10 years now, currently working at our Westport location, HSS Sports Rehab, Stamford Health on Post Road in Westport. So definitely been seeing a lot more pickleball, not just injuries, but people who, have other injuries from other things and want to get back to pickleball. So started learning a little bit more about it recently, playing a little bit, still a little bit of a, newbie to the game, but definitely see it's a fun game, and I think it's a great game for everyone to get involved with, and accessible for a lot of people. And actually recently, a park, 3 doors down from me opened up, some new pickleball courts. So I started hearing that clunk of the pickleball, and I was like, all right, this is a good sign. I got to get involved with this. So I'm going to talk a little bit more about the exercise-specific stuff. I do have some slides on, injuries that was already spoken on, typical injuries you would see, upper extremity, lower extremity. So we'll kind of go through those a little bit more quickly, but then we'll get into the meat and potatoes, which will be some strengthening exercises, some balance exercises, pickleball specific stuff. And then I have a dynamic warm-up program that there's a handout for. So I included some exercises. Should be a relatively quick, 5 to 10 minute routine that can be done on the court with minimal equipment. So we'll go through some of that too. This is from the same study that the docs already mentioned, so just going through some of the common pickleball injuries. Again, the common mechanism of injury, the most common is a slip, fall, or dive, or trip. It could also be hit by the racket, or paddle, or ball, and it could also be movement related. So as a PT, I kind of think about this part: how can we improve someone's movement quality, their strength, their control, their balance, to prevent some of those types of injuries. The rolling of the ankle, very common, and that could lead to other injuries as well, potentially fractures of the wrist or the arm. Again, we spoke about this already, but the age groups, we're seeing, typically that 50 years old and up is the vast majority of the injuries, but although we will start to see probably more younger people as this has become rampant and popular in, all age groups recently. I'm going to go through this one again. Again, the wrist is common, the lower leg. Personally, what I see a lot of calf and Achilles injuries. I see some overuse injuries, again, of like the elbow and the shoulder, tendonitis type things more chronically that flare up. I think commonly it's when, with any sport, when we start to get involved and ramp up too quickly, get excited about a new sport, start playing multiple times a week, and then you see injuries in, the early stage of, starting something new. So I think it's important to, kind of temper our excitement, especially if you're new to the sport, and kind of work your way into things slowly, and then hopefully the exercises will be helpful too. Again, we talked about this. Wrist fractures are much more likely actually in females because of some of the factors we mentioned, such as maybe lower bone density. Lower leg Achilles injuries, however, are more common in males, so 7 times more likely. I found those numbers pretty stark. And then there's always your chronic and repetitive injuries. So not every injury, a lot of those previous injuries we talked about from that study were warranting emergency department visits. There's always those chronic things that a lot of us and some of you probably deal with, that are maybe just kind of aching, they come and go. So your plantar fasciitis, your lumbar strains or sprains, disc injuries, flexor, extensor strains of the wrist, golfer, tennis elbow, rotator cuff, patellar quad injuries, meniscus, and so on. There's numerous, there's so many of them that we can list there. So strength training. I tried to pick some exercises that were, going to cover every body part and kind of cover, kind of mimic the movements that are required for pickleball. So You don't have to look like this guy to do strength training here, not necessary. But I just put some general recommendations, and a lot of you are probably very active with pickleball and other sports as well. So, you know, I put twice a week for the training, for this training program. You know, especially if you're playing pickleball 2 or 3 times a week, you don't want to overtrain and be doing strengthening exercises 3, 4, 5 times a day for the same body region. So break it up. General rule of thumb that I like to use is like 2 to 3 sets of 10 to 15 reps. That's a good rep range to kind of get some strength in the muscle, get a little bit of hypertrophy and a little bit of endurance. And then you're taking rest breaks between the sets. So a lot of people will say 3 sets of 10, and you'll want to just go and do 30 without taking a rest. So when they say 3 sets of 10, you know, you want to make sure you take that good 30, at least 30 seconds in between to recover, and then be able to get that 10 reps on the next set. And you should be working close to fatigue with each set as well. So if it's very easy for you and you're able to do 30 reps in a row, you're probably not challenging yourself enough to make a significant stimulus to create change and build strength there. So, but most importantly, moving in a controlled manner, so slow and controlled with all these movements, especially if there's things you haven't done. And if you do have a specific injury in the past, like maybe you've had knee pain and you're concerned about doing squats or lunges, or you know, you should discuss that with a licensed medical professional or PT or doctor before you begin that. And of course, avoid pain with the movements. So I'll start with the thigh and the hip. Any questions so far before we move on to this? Okay, so the thigh and the hip. So I put a progression in here. A lot of these start with being supported. So these are things you can do at home. Lunges. If you think about pickleball, there's a lot of small lunges happening throughout, whether it's forward, side to side. So it's important to be able to control that as you go forward. So you can start with hand on a countertop or on a dresser, and then lunging forward with that leg. And then you can progress to doing that without the support. And then you can progress to potentially holding a weight or a dumbbell in one arm. So if I were doing here, if I were doing with stepping forward with my right leg, you could hold the weight in the left leg, and then return up. And everyone's going to be able to go down to a different depth. So if you have balance issues or if you have knee pain, and you can only do, you know, if you want to do a small lunge, that's fine. And then you can progress as you get better with that into a deeper lunge. Deadlift is kind of similar, so this is a good one for balance as well. There's a lot of that in pickleball where you're reaching down for a ball, kind of mimicking that motion, right? So if you can get strong, this is a good one for the hamstrings potentially. If you're not in too much acute pain with that hamstring, to kind of strengthen and lengthen that muscle. So it's similar to the lunge in that you're holding onto a countertop with the right hand and then kind of hinging at the hip, sort of like this, right? And then back up. Okay. For the outer hips or the glutes, you know, everyone likes to talk about glute workouts, so this is good for your lateral movement as well. TheraBands, some of you may have seen the mini band loops. I have one here that I can demonstrate with. This can go up above the knees or down by the ankles. It'll be a little easier to do if it's by the knees, a little tougher by the ankles. And usually what I recommend is like walking back and forth laterally in a room, 4 to 5 laps for about 20 feet. This gets pretty tiring quickly, and you should feel it kind of towards your outer upper hips here. So this is the band I'm referring to. You guys may have seen one of these before. So this could either go here, you know, I would sit and put it on, or it could go down here, which would be a longer lever arm and be a little tougher to do. Okay? Do those all make sense so far? Okay. Lower leg and balance. So we talked about the Achilles and the calf, definitely an important muscle to strengthen. So I put heel raises in here. Very easy to do. You can have your hands on a countertop again, just for balance purposes, and you could start by going up and down on both feet. Again, once you can do that, 3 sets of 10 to 15, no problem, and you're not getting that fatigue, then you can progress to what we call an eccentric heel raise. So that would be more going up with 2 and down with 1. So I'll demonstrate that. So here, up with 2, lower with 1. This gets significantly tougher, so this might take a while to progress to that. And you would do both legs. Another way you can make the heel raises more challenging is if like putting on a backpack with weight. It's a little tougher to hold a weight with this one because you don't want to lose your balance while you're holding a weight, but putting on a backpack with some textbooks or something, some weight in there, that's another way you could do with 2 legs. And then the final progression would be a single leg heel raise. So just going up and down on one leg, again, a little more challenging for balance, but that is very, very difficult. So just some things to work up to. More for balance, so starting with a tandem balance, which is the picture on the left on the bottom, 1 foot in front of the other, holding that. We talked about how ankle sprains and falls are pretty common, so this can help prevent that. Progressing that to a single leg balance, and then the final one, and I'll show this one, is single leg balance with opposite leg reaches. So you can balance on one leg and reach forward, reach sideways, and reach backward. And this is all being progressed at your own comfort level, at your own pace. You know, if you feel like you're unsteady or wobbly doing the single leg balance or the tandem, then you stick with that, and there'll still be good benefit from that. Okay, core trunk, another hot one. Everyone likes to talk about core. What can I do for my core to prevent injury? So I put a couple mat exercises. These can be done, they can be done on a bed, but probably ideally on an exercise mat or a firm surface. Bridges. So bridge is like a glute hip thrust. Basically, you're going to tighten your glute muscles while you're laying on your back and lift your hips up. To make that harder, once you're able to do those without an issue, you can bridge and then do a march while you're up there. So you would lift your hips up and then march one leg up at a time, okay? For abdominals, marching type exercises are good. So lying on your back and marching one leg up at a time. Or you can do what she's doing in this picture here and start in that tabletop position and then lower 1 foot down at a time. That's a little more challenging because you're starting up in that suspended position and having to stabilize there. And then for more rotational stuff, since it is a rotational sport to some degree, you could do something called chops. So she's holding like a medicine ball weight. Could be any weight really. Kneeling, could be done kneeling or standing, and she's doing like a diagonal motion. So kind of here and coming up and across, and the whole time we're trying to keep our core active. Okay. Upper body. So shoulder, rotator cuff, very important. Scapular muscles. A lot of the muscles in the back of the shoulder with all the swinging can lead to some overuse there, tendonitis. So we want to keep those strong. So with our TheraBand, I'll grab my other band in a minute. You want to hold the band by your sides and pull apart, as you see in the first picture on the top. Another option there is to have a dumbbell and lay on your side and go up and down like that. So I'll demonstrate that first one. So here, 2 hands, arms by your sides. Doesn't take a lot with this one, you'll feel it. Okay, and these are similar to the loop band I showed you. They're just, we use them cut into strips, so just like that. The second one you see, I'll show you the standing shoulder tee. Only difference is up here, and you're gonna pull the band apart, okay? And that's gonna work some of the muscles behind your shoulder blades and in the back of your shoulder as well. And then wall slide, so this is kind of working more on that overhead motion again, and that overhead stability. So starting with the forearms on the wall, and then just sliding up a wall to the point where you're comfortable here. Again, if you get any pain or pinching with that one, you don't want to push through that range of motion, but again, everything's working within your comfort levels. Right, so there could be a number of things you're dealing with there. I think that's definitely a position, overhead, that requires a good amount of stability and strength in the rotator cuff, as well as mobility. So, we'd have to assess your flexibility too. Do you have the range of motion available to do it, right? To get to that, because if you don't, then you could be causing some impingement or some overuse of that rotator cuff area. But I think some of the exercises I showed there should be good ones for that, just to speak generally. And then it's definitely, especially with tennis and the serve, I would imagine it's more of a problem with the overhead. But, I would say definitely if you're having pain, something should be assessed if you're having pain consistently through there. But just the exercises I showed should be helpful, I think, for and safe for that, because you're not really going too far into that motion, and should help build up some stability. Okay. Any other questions so far? All right. Dynamic warm-up. Okay, so this is what everyone it has in the handout. So I'll go through some of these. I highlighted a couple of ones that are bolded here. Those are the ones that are pictured because they're a little bit tougher to understand, but you really just want to get your body prepared for what you're about to do. So you want to kind of get the blood flowing, warm up the muscles that you need. So often we just don't have time, or we don't want to do it, so we just get out there and play. There is a lot of research out there, maybe not for pickleball yet, but for other sports, that dynamic warm-up does help reduce for injury and in some cases improve our performance as well. So definitely a good thing to consider. So I recommend a light jog in place at first. Get out on the court, just get your blood flowing, then going into some air squats, which is basically just a squat in place, up and down. Here, right? Yeah, 2 sets of 10 to whatever degree you're comfortable with that. And then overhead reach with a toe touch. So I'll show this one. This would be both to get that overhead motion warmed up, so reaching as high as you can, and then down and touch the toes, right? And then up. And then if you can't touch your toes, you just go to here. And same thing with the shoulder. So these all have to be adjusted person to person. Forward lunge with trunk rotation. So this is a tough one to do. So if you could break these up and do them separately, but one thing you can try is stepping forward and then rotating to that side and then coming back. So step forward, rotate, coming back. So just to prepare you to come up and get a ball that's in front of you. Lateral lunge is the same thing, just stepping to the side laterally. So just to prepare you for that lateral movement you're going to need to do. So that would be more here. Right. Side to side like that. And I would hit both sides 10 times with that one. And then your typical shoulder circle. So starting with small, medium, and large, just to warm up that shoulder joint. And then I would get into more like sports-specific movements. So jogging around the court, so now we're actually moving, or at least up and down the court. Side shuffles, so shuffling back and forth from one line to the other 3 times. And then finally volleying. This is the part that a lot of people just go to right away. I'll go out and volley, as was said earlier. That should really be the last thing, and then you play. So build up your speed, build up your comfort level, and just get warm. So thank you, everybody. Any other questions? I know we're at the time now. Yep. How much time you should play, you mean? Yeah, some of it depends on your fitness level going into it. If you're sedentary and you're oh, I'm going to pick up pickleball now, I would say, playing 1 game was probably enough. But if you're someone who's played tennis, plays other sports, you could probably get away with doing a little bit more. So it's probably dependent on the person and the individual. Definitely, I know when I started playing pickleball, I consider myself to be in decent shape, and it's just different because, I run, I do weightlifting, I do other things still, but doing the more athletic movements, my calves were sore, my legs were sore, so I think building up gradually and not playing too many. I usually recommend not playing 2 days in a row right in the beginning if you're first starting, taking that day off in between to kind of recover, see how your body feels, and then get back into it.
I would add, just listen to your body. Your body knows when it's hurting, when it needs rest. So, don't try to push through things. And I think one thing that has been really great for me personally is I try to stretch in the morning when I wake up, and I try to stretch at night before I go to bed. That just makes all of these exercises when you get out to go play that much easier, because you've got a little bit more plasticity, a little more stretch, a little more strength in your system. And it's going to help throughout all your life, your balance, your muscle aches and pains, your back won't be as tight. If you just, while you're waiting for your coffee to brew in the morning, spend 5 minutes stretching. After you brush your teeth before you get in bed, spend 5 minutes stretching, and it becomes cumulative and it goes a long way.
That's a good point. I would say I usually recommend the dynamic stretching before, and then you can do some static stretching after. So after you play, right after your muscles will be warm. So doing our traditional stretching where you're just like, say I'm stretching my forearm here, holding the stretch for 20 to 30 seconds for, let's say, 2 to 3 reps on each arm. You can get some benefit from that because you're warm, you'll get a better stretch and potentially help you recover and not be as sore as well. So I like stretching just in general, but especially after playing as a cool down. Yep. Yeah. The best stretch, so I could show that one. I usually give you can lean against the fence or the wall, right? And kind of having the leg you're stretching back and then leaning forward with the heel down. So you don't want to make sure that heel doesn't come up or the foot doesn't turn out. So keeping everything straight and holding, again, for that 20 to 30 seconds is a good time frame. And then we went over the heel raises for strengthening. Those are great for the Achilles as well.
Yeah, we know that eccentric strengthening, so on the way down, so when you were demonstrating, so like coming up on your toes is using your Achilles, but going slow on the way down is called the eccentric part. And if you did it on a step, you could even get more of a range of motion. But things like Achilles, hamstrings, quads, like long muscles with tendons at the end, that's like the healthiest exercise you could do for any kind of tendon pains. Yeah.
All right. Thank you, everyone.